Hey everyone, I'm Dr. Michael Breus, the sleep doctor, and I'm here today to answer some of your questions about sleep. Please remember, this is not medical advice. I just don't have enough information on your personal case to be effective. You should always contact your physician with these questions as well. If you have a question that you'd like to see me answer, leave a comment below or send me an email at asksleepdoctor.com. And if you like these videos, we have a lot more on my YouTube channel, so be sure to hit that subscribe button. Question number 1 comes from Liz. She writes, I used to be such a deep sleeper, but since hitting menopause, that's a distant memory. I'm taking hormone replacement therapy, so no night sweats, but I still can't stay asleep and waking up around 3 a.m. every morning. Any tips specifically for menopause sleep? This is a great question, but it's also an important question. So one of the things I would tell you right now is I've got a great video on what to do when you wake up in the middle of the night, and all of that information is applicable to women going through menopause. Few of the things that you need to remember is consistent sleep schedule. Even if you wake up at 3 o'clock in the morning and don't fall back asleep, you want to follow your consistent bedtime. Don't go to bed early, go to bed at your normal bedtime. It's going to take a little while and it's not always so easy, but finding consistent sleep schedules is going to be important. Avoiding caffeine later on in the day, certainly not drinking any alcohol close to bedtime, and then once again, really being able to accept and relax during the middle of the night and not get so anxious. These are some of the things that are going to be super duper helpful for you if you've got menopause and are having some sleep difficulties. Also, don't worry, we've got some great articles over at sleepdoctor.com specifically about menopause and sleep. Question number 2 comes from Sarah, and she says, how normal or common is it to wake up every 2 hours if I ultimately get a total of 8 hours of sleep? If I fall right back to sleep, is that okay, or am I missing crucial sleep stages or steps? This is such a great question, and the good news is you're not missing anything. If you wake up and fall back to sleep relatively quickly, you are definitely still getting good, high-quality sleep. Question number 3 comes from Brent, and he writes, the only good vitamin comes with a prescription. That way you actually know what you're getting. Agree or disagree? This is an interesting question, Brent. So I think what you're trying to say here is prescription vitamins versus non-prescription vitamins. As we know, prescription vitamins usually have a higher degree of efficacy or value for most people. So I'm probably going to go with a lot of prescription vitamins if given the choice, but one must understand that there are many vitamin companies out there who are now meeting some of those prescription standards and making sure that you're getting high quality substances in your supplements. So you might want to check your supplement company out as well. Question number 4 comes from Jeff, and he asks, what is the best way to get used to a CPAP machine without losing even more sleep and having a detrimental effect on my work? Great question, Jeff. One of the first things that I do for some of my patients is I have them wear the CPAP machine while they're watching television right before bed, or they're sitting in their lazy boy chair in the living room for an hour or so, and we have them put the mask on. They don't have to turn the machine on, just get used to having the mask on their face. You do that for about 6 or 7 days, then you can turn it on very, very low, like at the lowest pressure. Once again, to just get used to having some air come across your face. Usually you do that for another 7 days, and most of the time people can fall to sleep fairly easily with their CPAP machine. Question number 5 comes from C. Pilar, and they ask, I need to sleep with some degree of light in the room. I sleep crappy anyway, but if the room is not total darkness, I have terrifying nightmares. Is that okay? Absolutely. One of the things that we know is that while any light during your sleep can have an effect on your sleep, nightmares have a much bigger effect on your sleep. So if you're always having a nightmare anytime there's total darkness, I would say, number 1, it's perfectly fine to sleep with the light on. But number 2, maybe it's time to talk to somebody about your nightmares. There are now nightmare therapies that are out there, and there are significant ways to help reduce nightmares. I've done some training myself, and I've learned that almost any treatment for nightmares helps lower the frequency and the intensity. So I would highly recommend that you check out some of my articles about nightmares, or maybe find a dream therapist that could be helpful for you. Thanks so much for all of your questions. I have plenty more answers to your burning sleep questions, so check out another episode of Ask the Sleep Doctor right here. Remember, if you have a question you'd like to see answered, send me an email at asksleepdoctor.com or drop a comment below. This is Dr. Michael Breus, the Sleep Doctor, wishing you sweet dreams.